Back on Morningline, our guest this morning, as we're talking about heart health in February, Heart Awareness Month, is Dr. Joshua Beckman. I'm wondering what he had for breakfast this morning.
So far, just black coffee.
Just black coffee. And you know, just before I came up here, we did a news story about another study supposedly saying coffee, not decaf, but coffee, fully caffeinated coffee is actually maybe helpful to your heart. You know, you hear that back and forth. It's crazy how you get these different studies that come out, but they say, hey, a cup of coffee, probably good for you, as opposed to, they say decaf, not the same, so it must have to do with the caffeine.
The answer is I have no idea. I know the study you're talking about and how it prevented heart failure. These diet studies are always really difficult to interpret. I agree with you. Every 3 weeks there's a contrary message.
Oh yeah, and you're right, it's contrary. There'll be another story, you know, and the bottom line is someone's going to see that and think, oh, I'm going to have a whole pot of coffee today, and we know that undeniably is not good for you. But I certainly think 1 cup of coffee or 2 even maybe throughout a day, which is about what I average. I don't know how much it helps me, but I can tell you this, it's not hurting me. It's just not. And someone wants to tell me a cup of coffee hurts you is just, I don't buy it. But you know, whether or not it really is protecting my heart, I take that with a grain of salt. Let's go to Nina. Nina, good morning. Hi, Nina. Are you there, Nina? Nina? Are you there, ma'am? All right, I'm going to put her on hold and we'll see if we can get her. Maybe a loose connection there. Doctor, while we wait to see if we can get Nina back on the line, can you tell me then again, the idea of having high cholesterol, it's not something you can really look at. There's nothing that manifests itself or that you feel necessarily, unless you all of a sudden have a heart attack, ahead of time without getting a blood test, right?
True. That's why the American Academy of Pediatrics suggests that you get your first cholesterol checked between ages 9 and 11. And the CDC suggests that in adults, beginning at age 20, you have your cholesterol checked every 5 years at any level of risk, and then more often as needed.
Yeah, is there anything you can look at? I remember years ago someone saying if you made a fist and you looked and it looked like there were pockets of fat on your knuckles, that might be a sign that you have high cholesterol. Is that a falsehood?
No, you can actually have the cholesterol deposits on the tendons. That's one place. It could be around the eyes, but that's literally looking for the most extreme cases, and I would not wait for that sign to develop.
Yeah, okay, I'm not. And by the way, Nina, she didn't take the call because the question she had was about the coffee, and so we answered that for her. In terms of other foods, I think you as a heart doctor would say the same thing that any other doctor that's treating any other ailment would say. Healthy living. You hear a lot about certain heart health foods like dark leafy greens. I know ever since that started coming out, the sale of kale over the last decade and a half, which used to be nothing more than a garnish on a plate, has skyrocketed. All right, is it good to eat kale? I mean, heck, you can even go to Trader Joe's now or any number of stores and buy kale chips. So what do you think of kale or other dark green leafy vegetables?
I think you're bringing up a really important point about food colors. So first of all, the green vegetables are great, and it doesn't have to be kale if you like lettuce or broccoli or celery or pea pods or anything that's green. But I would also suggest red tomatoes are good, yellow peppers are good. There's no limit on the vegetables that you should be eating. That vegetables are good in general. Green leafy vegetables certainly have things like vitamin K, which is healthy for you, but all the vegetables are really important. And don't limit your color just to green. You can go broader than that. It's and safe and healthy for you.
You know, I have a kind of a general rule of thumb I don't really follow all the time, but I only eat very few things that are white. All right? Okay, and the one thing that I will eat a lot that's white, and you're thinking, Nick, well, you know, I'll eat some rice every once in a while, and I'll drink a little milk once in a while with a cookie. But the one white thing I really do eat is cauliflower. How about cauliflower?
Spectacular vegetable.
Yeah.
And I think it's, you know, the white foods are really an interesting case, right? Because it's potatoes, it's rice, it's bread. And yes, you want to eat those in moderation. But cauliflower is no different than all the other vegetables I mentioned, and you should feel free to have them as much as you like.
Yeah, isn't that interesting? Because, yeah, I place limits on the other whites. And I love white type food like you just said, but I just don't want to overdo it. They're either starchy or they're fatty or they have, more sugars in it, and cauliflower is one that's safe you can go with. And I'm not sure if these foods contain it, but we can talk about vitamins. You don't hear it maybe as much anymore, doctor, but there used to be a bunch of I guess, reports and studies on antioxidants. Now, do antioxidants come in certain foods, and is that something you should take a supplement for that does have an effect on the heart? And what do they do?
So a couple of questions there. First, no, I don't think you need to take supplements. The vitamins that are antioxidants were tested in very large populations and don't really have any kind of benefit. That said, there's lots of antioxidants in foods, which these are the healthy foods. And I think by eating a healthy diet, you can accomplish what you'd like to accomplish. What is the problem with oxidants? Oxidants seem to make the blood vessels more susceptible to the development of cholesterol plaques. And so clearly we want to have a better antioxidant balance, but unfortunately doing this by vitamins is not the way to go. It doesn't help. Yeah,
just get it naturally, I guess, the best you can. See, I personally, Doc, am a big fan of resveratrol. Okay, but I'm not taking the tablets. You know how I get my resveratrol?
Red wine?
Of course, in moderation, of course. Is that a falsehood, or you hear about the French paradox? They eat all these creamy, rich foods, and their cholesterol not quite as much as you would expect considering their diet. And one reason some folks think is because they drink red wine, not to get drunk, but in moderation, and it maybe protects their heart.
Well, I will say that as a physician, I will never recommend drinking alcohol. But that said, there is a relationship between having low levels of alcohol, a glass maybe, and better heart health over the long term.
So when you talk about red wine, and I hear what you're saying about not advocating for drinking alcohol, would you get potentially the same resveratrol effect from drinking grape juice, which is not fermented and turned into wine, obviously?
That's a good question. I'm not sure, actually.
Okay. Right.
As far as I know, I don't think that it's. I don't know. I'm not going to guess one way or the other.
I understand. I was going to put you on the spot on that one. Let's take a call from Tommy. Tommy, good morning. Hi, Tommy.
Good morning. I have a comment and a question.
Sure.
And okay, back in 2015, I'd had my physical. Now, I've never been a smoker, and I exercise, and at that time I was, like I say, I was 62 at that particular time. I'm 78 now, but all my tests came back perfect, no problems whatsoever. And so about 4 months later, after the physical, I have a heart attack. So they do quadruple bypass. So my doctor was actually kind of both of them, but really come to find out it had to be hereditary. My father died from a heart attack. That's really all I know about my father's side. And my mother, about all of her brothers, died from heart attack. So here I am now, we might say 15 years later, and I've tried to exercise and tried to stay healthy. Now, I don't eat probably like I should eat, but the problem I have right now, back during the early part of the summer, I broke my back. And I had to have 2 back surgeries. But the cardiologist came in there and said I had no blockages and I seemed to be healthy. So I'm trying to get back to exercising right now. I walk in the morning a mile.
Good.
And try to get another mile in later on during the day. But my real question is, okay, that's been about 16 years or 15, 16 years since I've had this done. What's the lifespan on bypass surgery?
How old are you again?
I'm 78.
78. Okay, Doc. It sounds like he's doing everything right after the fact. He's 78. He sounds strong there.
Yeah, so there is no end date to bypass, right? But what there is, we can tell you that depending on what the bypasses that they used, if they use what's called a lima, which is an artery from one part of your body to plug into the heart vessel, that one can last 20. I've seen 20, 25 years without a significant issue. The other ones, if they use veins, don't usually last that long, but how long you live and how you feel is mostly associated with that artery that they use to bypass. And if you've had a recent check and the doctor said all your vessels are open, then I think you're doing great. And I would suggest that you have a long time to go, as long as you take care and do all the things you're supposed to do. But I don't see an end date.
And it's interesting, he said that he ended up having that heart attack despite what appeared to have been a clean bill of health from his doctor. What are the other causes, or can you have a heart attack if you have low cholesterol? I mean...
Yes, actually, so he mentioned the one that you and I talked about a little bit earlier that is really the other really important thing, and that is he has a family history.
Okay.
And if you have a family history where your father had a heart attack at a young age, and your mom, if you're a male, and your mother's brothers had them, then you certainly are at increased risk. And even if your numbers look good, you really need to be very careful and aggressive about lowering that risk. Also, I'll tell you that patients with diabetes don't necessarily have high cholesterol, but they certainly have an increased risk of having a heart attack. And even if their LDL, for example, isn't very high, we use a statin because it lowers their risk substantially.
Obviously, tying in with high cholesterol, we didn't touch too much on high blood pressure. That plays a role as well. And I guess many patients who are at severe risk have both high cholesterol and high blood pressure.
Yeah, I would say high blood pressure is probably the most important risk factor we don't talk about very often. It's probably the one that causes the most cardiovascular disease in the United States, if not the globe. It's also the one that's, we call it the silent killer because you don't feel it until it's too late. It can not only cause heart attack and stroke and heart failure, but also kidney disease. And it should be measured routinely every time you go to the doctor. The medicines we use to take care of it have been around for decades, and we know that they're safe and pretty much side effect free. So I think that there's a big upside to knowing your numbers and getting them in the right range.
Yeah, it's interesting. You say, maybe some people should get their blood tested once every 5 years, depending on the age and such. I mean, as long as I can remember, because as I said, I understood we had a family history. I've had my cholesterol taken sometimes as often as twice a year, but definitely at least once a year. It's the whole blood scan, they come back with the breakdown, and they do a liver enzyme count as well sometimes when I'm on Crestor or Lipitor. Can you talk a little bit about that as well, what they're monitoring there sometimes with regard to statins?
Sure. So the first thing I'll say is that when you're 20, 25, 30, 35 years old, you don't need an annual cholesterol test. When you get into the more mature ranges, you need it a bit more often to make sure it's not going off the rails. One of the early side effects that we heard about from statins is that it can annoy the liver enzymes. Liver enzymes are the liver is the place where it breaks down the medicines in the body and then helps it to be eliminated from the body. Sometimes the liver enzymes can be taxed, and we see the liver enzyme numbers go up, suggesting that the liver's under stress. However, even mild increases in liver enzymes are not dangerous, and with statins, they tend to go away after if you just continue the treatment after a period of months. The statins are so safe now that testing liver enzymes is not recommended because the problem with the liver happens so infrequently.
Interesting. And that's good to hear. Just over the years I've used it, that now that we do have a track record, you're convinced it's safe. I remember when I went on Crestor, we shifted for whatever reason from Lipitor, and they said, let's try this one too. Not because I was having a problem. They said, this new one's really strong. I guess Crestor has a track record now, and wow. I mean, in a matter of like a week, my cholesterol went way down. I mean, it was that fast. And I can't recall any substantial side effects from it, whatever, but boy, did it work. And it was on a small dose.
Yeah, so you're exactly right. It's one of the most potent statins we have, and it has a tremendous effect in lowering your cholesterol. It can drop your bad cholesterol by 50%. It's an incredibly good drug. All the statins have beneficial effects. A lot of it's related to lowering the cholesterol number, and the lower you get your number, the better you're going to be doing.
But would you say that you would prescribe potentially a statin drug to someone who does not have a cholesterol problem, but just as a prophylactic to prevent it? Or is that not something that you would want to do, to take it if you really didn't need it, just to maintain so it never goes up?
So you remember I told you that you should consider understanding your risk over the course of 10 years. We've also got to think about this in lifetime risk, because over time, it's very likely that someone who's 30, by the time they get to 60, 70, 80, will have some heart disease. What I would say is this: the statins are really good at lowering risk. A lot of it's from cholesterol, but you can have a high risk independent of your cholesterol, and this drug is the one. This class of drugs are the ones that can lower that risk. So if you were a smoker and you had diabetes and your blood pressure was off and your 10-year risk was 10% or 15%, even if your bad cholesterol wasn't terrible, I would put you on a statin. I use this to lower risk, not just the cholesterol number.
Interesting. Okay, listen, on that note, let's take a break. Back with the doctor, our final segment right after this.